Here are 10 tips to help you with a weight stall. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to our, frequently asked questions section. And it's so common that I get patients ask me, I'm on a stall, I've been on a stall there for a week, for 2 weeks, what can I do? And here are 10 tips to help you with that. Tip number 1, and you knew this was coming, you need to cut down on your carbs. Yes, cut down on the sugars. And studies have shown that diets that have low sugar or low carb diets or keto diets work really good because you'll have access to that stored fat in your body and get rid of it faster. And of course, it will help you with the weight stall. Then again, it works fantastic along side by side with a weight loss surgery procedure. Tip number 2, you need to track everything that you eat. Nowadays, easy with apps, with smartphones. You can use MyFitnessPal. There's many other apps that can help you track absolutely everything that you eat. That way, it will give you a broad spectrum of how you eat, what you eat, your macros, how much fat, how much sugars, how much protein you're intaking, and that way you'll be able to adapt. Tip number 3 is don't skimp on protein. You need the protein. And if you're a weight loss surgery patient, even more. That way you will preserve your muscle, and the way you're going to be losing weight would be from the stored fat, which is what we want. We want you to store, preserve that muscle tissue and that energy that you need, those calories, for your body to grab them from your stored fat and use that as fuel. So don't skimp on protein. You need the protein. Focus on the protein intake. And you know what? You need to spread it throughout the day, because I have patients that come to me is like, well, how many grams do I need a day? Do I need 50, 60, 70 grams? I'll eat them in just one sitting and I'll forget the rest of the day. No. Spread it throughout your day. Tip number 4, exercise. Wait, Dr. A. But I do exercise. I'm not saying you don't. You need to increase. If you want to break this stall, you need to increase the frequency. And you got to increase the intensity of the exercise. Don't keep it the same pace because the scale's not moving, because it's that same pace. Increase. Get your heart rate going. Measure it. Get a tracker. See how much effort you're putting into it, how your training effort was. Because if you don't do this and you're doing the same thing, you're going to have the same results. Tip number 5, you need to manage stress. Wait. Dr. A, I just have a stressful job. I can't change it. I live it every single day. I understand you may have a stressful job, just like me. How about taking a different habit? How about picking up on meditation? Have you ever tried meditation? Have you paused your day for 5 or 10 minutes just thinking your thoughts, and just a pause throughout your day to help you manage stress? And that's just one way to put it. How about picking up exercise? How about just going for a little walk? Think about it. Tip number 6, I'm sorry to mention it, you need to avoid alcohol to help you break the weight stall. Alcohol, I don't want to know how you put it, in what presentation. It could be a beer, it could be vodka, it could be tequila, it could be whiskey, it could be rum, it could be whatever you want. It is a carb. And we talked about that initially. Tip number 1, to avoid carbs. Yes, alcohol is sugar. It's carbs, all right? So you need to avoid the intake of alcohol to help you get past this stall and get you going. Tip number 7, how about if you try intermittent fasting? I do it every single day. Last meal I eat about 6, 7, and then I go up to the next day till 1. I eat normally 1:30. And you can track it. There's some apps for that. I don't use an app anymore because I know my timings now, but you might give it a try with an app so you can actually see a visual. How long is your clock? Where you're standing right now with the timing, the fasting. There's different types of fasting as well. So intermittent fasting works a lot, helps get you going with lowering carb intake, getting into a keto stage. Works really good. So you might give it a try. Tip number 8, and it'll probably go along with intermittent fasting, is you need to drink more water, black coffee, and tea. Yes, when I do intermittent fasting in the morning, when I wake up 5:30, 5:45 in the morning, and I don't eat anything till 1:30, as I mentioned. The only thing I drink is water, coffee, black, no cream or sugar, all right, or tea. And that will help you have a lot more, fullness throughout your day, eating less calories throughout the day, and get you going past this weight stall. Tip number 9, this is a really good one. You need to be very careful about your sleeping habits. Yes, sleep is very, very important. Myself, I track it with an Oura Ring. You don't need an Oura Ring, but I track it. I track how much good quality of sleep I get, how many hours I slept, what time I went to bed, what time I woke up, how is my REM sleep, how is my heart rate during my sleep. This is the Oura Ring. This is what it does, you know. You don't need to, you don't need this thing, but at least track that the amount of hours you're getting of sleep, the room temperature has to be nice and cool. Avoid alcohol consumption. Avoid eating too late, having a late dinner and then going to bed. It will affect your sleeping pattern. And having a good quality of sleep will help you definitely get you going with weight loss. Lastly, tip number 10, eat more vegetables. Yes. If you eat more veggies and you try to consume veggies with each meal, you will be increasing your daily fiber, which is fantastic. And for weight loss surgery patients, even better. And also by eating fiber, you will feel fuller, quicker, with less amount of calories or calorie intake throughout the day. So it helps you all around. All right, so those are 10 tips. If you found this information useful, leave me one of these. Very useful. And remember that weight stalls are needed. They happen. They're expected. Your body's adjusting. And these 10 tips will definitely get you going and break that weight stall. Keep focused. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.